When was the last time you calculated your patient loss? That's what we're covering in this tip. Hi, my name is Jeff Santone and I am the new Client Services Director here at MGE. Prior to being at MGE, I have owned and operated an oral surgery practice and 3 general practices, and I am well aware of patient loss. Patient loss is also known as your attrition rate, your churn rate, your burn-through rate, whatever you want to call it. It's basically what are we losing through the back door. And if you're like most offices, you have no idea what that number is. And as an example, I was talking to a doctor in 2020, October. It was the end of October, and I had them pull their patient master list. And at the end of October 2020, they had seen 1,200 patients to date through the whole entire practice. Doesn't matter if it was hygiene, emergency, doctor. 1,200 patients. You want to think for a moment, how many do you want to guess were scheduled into the future? And I'll give you one moment. 700. 700 of the 1,200 had an appointment in the future. That means that year alone, through October, 500 patients were at risk of being lost completely. Now, why don't most offices know this? Well, in the case of this office, they're getting 50 new patients a month, and it's even Steven. I've lost 500 over 10 months, and I'm getting 500 in new patients, so we're just as busy as we've ever been. And if you are a practicing doctor who owns your office, the value of your practice is active charts. So we have to figure out what is our patient loss rate. The easiest way to do it is to go to your practice management software, download your patient master list. Most patient master lists will have some criteria. One of those criteria is typically last date seen. I would like you to go back 5 years. Set the last date seen as 5 years ago. Put it into an Excel sheet. Remove anybody who has an appointment into the future. That means today or later. The rest are patients that are in the wind. If you total that number, you will have your loss rate over 5 years. If you sum that number by year, you'll have your loss rate per year, and you can start to get an idea of what you're losing year after year. This is a great exercise in bolting the back door. What are we losing? What could we get in? Your best source of new patients are patients that you can get to return. Better yet, that you don't have to put into reactivation. So let's bolt the back door, let's find out what our attrition rate is, and let's do something about it. Pro tip, that list that you just downloaded is now your recall hot list. Anybody that is last date seen from 6 months to 1 year, they are ready to come in right now. They are primed. Let's get on the phone. Let's call them. Thanks for tuning in. If you like this tip, click like. If you want to see more tips like this, then click subscribe. I'll see you at the next tip. Take care.